Does your child snore excessively loud? Do you hear pauses in his or her breath when you listen to them sleep? Do they always seem tired? If you answered yes to any of the three questions, your child may have obstructive sleep apnea. My name is Jake Lawrence, and over the next couple minutes, I'd like to inform you a little more about obstructive sleep apnea. First, what is obstructive sleep apnea, or OSA? It is a sleep disorder in which breathing repeatedly starts and stops throughout the night due to a blockage in the airstream. Now, this isn't just once or twice a night. In mild cases, someone will stop breathing 5 to 15 times an hour, and in severe cases, this can go all the way up to over 30 times an hour. What does it look like? In the top picture, you can see normal breathing, and the blue arrow shows that it can go from the nose to the throat very easily. In the middle picture, there's snoring, where there's a partial blockage and not as much air can get through. And finally, in the bottom picture, you see OSA, or a complete blockage, and no air is getting through. What are some causes of OSA? In children, it's usually due to an enlarged tonsils and or adenoids, and sometimes other abnormal growths in the airway. In the general population, it's usually obesity. When someone is obese, they tend to have extra fat around their neck, and when they sleep in a relaxed state, the fat blocks their throat and no air can get through. I'd now like to talk about the Down syndrome population, because they're predisposed for OSA due to their short nose and flat face. In the pediatric population, in a recent study, it was found that 0.7 to 2% of children have OSA, but when you specifically look at the Down syndrome population, that number jumps drastically to 30 to 60%. What are some possible consequences of not treating OSA? You'll see an increase in daytime sleepiness, which can cause a decrease in cognitive function, which is the ability to learn, and a decrease in mood, which may in turn mean an increase in bad behaviors. We see an effect on the heart because there's extra stress put on the heart when there's a blockage and you can't breathe, and this can lead to hypertension, which is high blood pressure. Finally, the worst consequence of not treating is sudden death, not to be confused with SIDS, which is sudden infant death syndrome. Sudden death meaning you just want to go to bed and stop breathing. So what should I do if I think I or a loved one has OSA? You should make a doctor's appointment and tell them about your symptoms. They may refer you to a sleep specialist or order a sleep test. Make sure you follow through with these for the best treatment. What are the treatments? As I said before, in children, tonsils and or adenoid removal seems to be the usual treatment. In the general population, obtaining an ideal body weight if you're obese can help decrease your OSA. Also, using a CPAP machine, which floods your throat with air continuously so blockage cannot occur. And you may need surgical removal of other obstructions in the airway. In the Down syndrome population, tonsils and adenoid removal will be the most common treatment. As you can see on the left, normal anatomy. He has normal adenoids and tonsils, so the air can get through very easily. On the right, common causes of sleep apnea. The tonsils and adenoids are enlarged, and it's harder for the air to get through. So what should you expect if you get treatment for OSA? You should see a decrease in snoring, a decrease in daytime sleepiness, which, as we talked about before, could increase cognitive function, so you may see your child perform better in school, and increase mood, so you may see a decrease in bad behaviors. Finally, you'll see an increase in quality sleep, which is great for your overall health. I'd like to end this video by asking you to do a couple of things. Please take the survey in the description so I can see how effective this video was. It shouldn't take more than 2 to 3 minutes. Please feel free to email me with questions or news such as you made a doctor's appointment because you think you have OSA. Finally, there are some useful links in the description that give you more information about OSA.